And then the third thing that we showed in our study is that
Sorry,
we could.
just a quick one. CD4 to CD8, is there like a normal ratio, an optimal ratio? And CD4, if I remember, that has to do with HIV. That was the main thing in HIV, right?
It does, exactly. So that's a great question. I'm sorry I didn't address that. I have not actually been able to find, like when we think of things like CD4 to CD8 ratio or even TNF alpha or VEGF, what's the clinical threshold is I think what you're getting to. Like, is there a level where you should be, or else if you're not, then you're at this risk of,
right.
X, Y, or Z. So to your point about HIV, and actually we ran another study in people with HIV that we looked at this. What we do know in HIV is that if that CD4 to CD8 ratio goes below 1.0, so it gets less than unity, then that is definitely where if someone has HIV, that's a problem. And then 80% of the time, the infectious disease physician will try to change the medication regimen to help the ratio get back above 1.0. And this is a separate study that we could talk about maybe in another interview. But we actually showed with the rice bran polysaccharide, we got that value up above 1.0, whereas the placebo did not. But in terms of like general health, that's a great question. I haven't been able to find the ratio where it's been documented or validated that says, okay, you want your CD4 to CD8 ratio to be above this value and then you're good. Unfortunately, I haven't been able to come up with that value, but.
Got it. But what have you been seeing from your work? So should it be like, have you seen that 2 to 0 or 2 to 1.5? It looks so brain health?
So in the Alzheimer's study, we went from, I believe it was like 2.2 at baseline to 3.5 at 12 months. And that correlated with the cognitive function. So it would appear to be that, anything above 3, I guess to kind of, give you some sort of an idea of a value, anything above 3 would definitely be, in this case, better. And remember, in our study, these were people with moderate to severe disease, and they also had other comorbid conditions. So these were very sick, and they were 79.9 years of age on average. So very severe disease, very old, and had other comorbid conditions as well.
Got it. So with the CD4 should be like 3 times, or not, I shouldn't say should be, but what you've seen is that 3 times higher than the CD8, which is the inflammatory proteins. The CD4
right.
Proteins, the CD8 are the inflammatory or the pro-inflammatory proteins. Having a ratio of 3 times that of the CD8 seem to be more helpful or beneficial towards brain function. Is that a good layman's way of saying it?
Yes, perfect.
Okay. Hi, I'm Dr. David Ajibade. Thank you so much for watching this video. If you would like to see more videos, please click on the subscribe button below. And if you want to be notified of when we upload other videos, please click on the bell button so that you can be notified. God bless. Take care. Bye.